Morning, Tewksbury. It is Friday, January 7th, 2022. It's 11:06 a.m. I'd like to call this emergency meeting of the Tewksbury Board of Health to order. And right now we do have a quorum because we have Maria Zaroulis as well as Charlie Rue on the phone. So three out of the five members are currently present. Today's meeting is going to be brief, but we'll plan to at least have a follow-up meeting next Friday. Back in end of August, the board had met about mid-August as case counts are starting to creep up, and we mentioned that we would be revisiting the numbers each week when town manager sends them to us. And when the need arose that the numbers were indicating that we need to come together and meet before a monthly meeting, we would do that. So today is that stated purpose. I'll turn it over to our director just to go over the current numbers and why we're here.
So currently, for the past week in town, we've had 499 active cases of COVID. The numbers that are reported do not represent the rapid tests that are being taken at home. They don't get reported into the state system where we pull these numbers from. And the previous week, for January 1st, there were 528 cases. And that is an increase of 377 cases from the end of December. So we are in the midst of a surge, and we are seeing increasing numbers weekly. The breakdown of ages, it's not necessarily in the elder population. The 70 to 79-year-olds are averaging less than 20 cases a week, and the 80 plus population are less than 10 a week. Majority of cases are from 10 to 40 years old.
Okay, and Brian, is there a way that I can share my screen?
Sure, let me just give you permission. Yeah, looks like you should.
Okay. So I have on the screen, and I'll send it out at the end of the meeting. It's the numbers that Richard has been saying to us. I've also done the same thing, pulling the data straight off the state's website, and I have added statewide column, but I've indicated both Wilmington, Tewksbury, Billerica, and Lowell just for comparison. So the graph here is the average daily rate of COVID per cases per 100,000. And it goes all the way back to December of last year. And everything had come down nice during June, little bump up towards the end of summer vacations. But the concern now is that now that we're into December, and really since Thanksgiving, we've had increase. Where my mouse is where we had been back on a week ago. With the numbers that Shane was just talking about, we are much higher, and we're also we've been outpacing the state rate, but we've had a noticeable spike up, and that was my concern. And that's really including Christmas gatherings or holiday gatherings. And these numbers have yet to include what has happened, the result of New Year's celebrations. So I wanted to call this meeting today because I'm concerned that the numbers are really skyrocketing. And I think, too, these numbers are probably underreporting the actual number of positive cases we have in town, because there's a whole host of factors involved. One, it's almighty tough to find a rapid home test kit. And even with them, unfortunately now, when people are doing the best to try to buy a kit from a pharmacy and they're out, you go to wherever you can find it. And unfortunately, there's been a lot of press lately that people going to Craigslist or Facebook or eBay or other online purchasing platforms to buy self-test kits of dubious reputation. There are long lines to get a PCR test, so that's been discouraging people. Having gone through it myself, I thought I just had a regular fall cold, and it wasn't until my daughter suggested I rapid test myself that it said positive, and PCR backed it up. So for folks that are vaccinated, if you do happen to get it, you may readily mistake it for a regular cold or something else, because you're not going to get the full bore symptoms. You're not necessarily going to get many, if any, of the symptoms that are on the checklist. So I think a lot of us may be out there with sniffly noses, and more symptoms that may not think that it's COVID because I'm vaccinated. So from the board's perspective, really want to let the residents be aware that the numbers are increasing, but to remind people there are steps that we can all do to try to hopefully keep this curve from going even higher. So with that, looking at trying to get residents to not only, as well as businesses, to come back to what we had done successfully to bring this curve all the way down to a low point. Things that had been done successfully by residents were, yes, face mask is still recommended per CDC guidelines, because it will protect you from other variants. The flu is starting now to ramp up as well. Hand washing, frequent hand washing, use of hand sanitizer when you're able to wash your hands. You wash your hands or sanitize your hands when you take your mask off. Social distancing. You go into any store and you may see the little shadow mark on the waxed floor where the 6-foot social distancing sticker had been before. Well, just because stores don't have those stickers on the floors anymore doesn't mean that people should forget about social distancing. So we're hoping that just for the month of January, and we'll continue to evaluate, but at least for the month of January, if people go back to practicing all the things that we've done successfully to bring our curve down to almost zero. If you're going to get groceries, for example, Market Basket had set up hours for the elderly to be able to, they'd open the store early. Those folks would go in and get the groceries before it was filled with other customers. So if you're in that boat, or if you have health issues, you may want to consider going to a store like that, or any store you're going to, not during peak hours, but during much lighter hours, so you have much less chance to come in contact with a lot of people. And you may want to re-give thought to where you're going right now, and can you just buy something online, and do you need to go to the store just for the next couple weeks? Stores, the grocery stores, the pharmacies in town all have signs on the doors highly suggesting that people wear masks, especially if you're not vaccinated. I've personally been seeing that more people are wearing masks lately than before, which is a good sign. But mask wearing alone is not going to be the only remedy we have for it. It's a part of the remedy, but it's not the sole remedy. So we're just asking people to get back to practicing the things that we've been doing before that help bring the case count down very, very low. And hopefully we can, if we do this, we'll see the number of cases dramatically drop by as we get towards the end of January, beginning of February. So I will turn it over to my esteemed colleagues, Mr. Rue or Mr. Rules, if you have any comments.
The only comment I have about this, as far as trying to bring the numbers down, is yes, people need to continue to wear masks when they go out, whether it be to a store or whatever it is, but it seems that it's the large groups, it's the gathering in people's homes, it's the parties, it's the, going into bars. No one is wearing a mask in those situations, and that seems to be where the numbers are increasing. It's due to those situations. So I feel like it needs to be reminded, people need to be reminded that if you're going to do something like that, you really need to be extra careful, because I think your risk of contracting the virus or even having it and not realizing it and giving it to somebody else is much higher in those situations than going into Market Basket at this point.
Yeah, I think one of the telling things was it was no longer a single or two age categories that seemed to have the predominant number of cases, but it was pretty evenly distributed among all the age categories. Charlie, any thoughts?
Are you there?
Yep, we're here.
Okay, yeah, just a quick one here. The community, we've had 2 years to figure this out. We've lived with this for 2 years. The people in this community are not stupid. The virus isn't going anywhere. The virus itself has evolved itself, depleting itself from Delta to Omicron. It's in transition, much more contagious than the former Delta, from what I understand. But as you said earlier, Ray, people know better in terms of, and let me just say this and make this very clear so people don't misinterpret anything I say here. I am not anti-mask. I am not anti-vaccine. Absolutely not. But people know better. They know when they should wear masks. They know when they should get vaccinated and boosted. They know when they should attend crowded venues, or if they should attend crowded venues. They know how to social distance, and they know how to apply proper hygiene and sanitation. We're not babysitters. I think that you're right, Ray. We have a responsibility to inform the public that these rates are going up. But again, not to scare the hell out of people in terms of, I believe most of these cases are probably the Omicron variation. And again, if people feel the need or the want to wear masks, then go for it. If you want to get boosted, reboosted, whatever you want to do, go for it. The social distancing is, we all know how to do this. So if we're just putting out a statement of warning, I think that's a good thing to do. Thank you.
Thank you, Chair. Yeah, we really just want to remind residents to get back to doing what you have been doing before that collectively helped bring the case count down greatly.
I agree.
Okay. So so I'd like to have us do, and I talked to Member Scarano yesterday about the best way for handling this. While the board can vote and make a recommendation of what residents should do, I think that what the board should do instead would be to vote to ask that Director Sullivan put together and issue a public health advisory for the residents that, again, just incorporates what we were just talking about reminding people of all the strategies that they can do and should be doing to minimize the spread of COVID, as well as flu or anything else that's out there. And to make this be something voluntary. Again, we look at meeting again next Friday just to see where are we with the numbers and what has worked in this week and what hasn't, what we may need to do, if anything else, further. But I think the best way of getting this information out and having some sense of importance that people need to at least read it would be in the form of an official public health advisory that we would ask to be sent out to residents from the department. We're not going to be the ones that actually read it. So we have to vote on what the wording is, but I think at least if someone would like to make a motion that the Board of Health asked the director to put together a public health advisory and issue it to residents on
Mr. Chairman,
can protect themselves from spreading COVID.
Mr. Chairman,
Yes.
can we include some of these businesses in terms of reenacting some of their sanitation exercises, not unlike Market Basket may be cleaning, the basket handles prior to people coming in and whatnot. So we kind of extend it to the businesses that we recommend that they maybe, go back to some of the, the sanitation protocols we had before. Just, as a recommendation, not anything that we're, that we're edicting or anything.
Yeah, sorry, I should have mentioned that. Yeah, so the communication is out to residents. We'll also have a similar one out to businesses in town. Just again, highlighting what they had done before that had worked well, and highly suggesting that they revisit implementing those again, short of making it a mandate. If the numbers keep increasing, we get calls from businesses that they really need us to provide some support for them, then we can discuss that at next Friday's session. But I'd rather at least make it voluntary now, because people know the right thing to do. We just need to remind them of they need to be doing it again. So I guess if someone wants to put forth a motion to have the department issue a public health advisory both to residents and then I guess it's easy. We just do as a combined as a single document that goes both to residents as well as to businesses. Just reminding them, asking them to go back to the things that they were doing, and we'll be specific in what those are.
I'll make a motion for the health department to provide the residents and businesses a public health advisory for the month of January.
Yeah.
I'll second that.
Okay. So motion's been put forth and second to ask the director to issue a public health advisory. We'll take a roll call vote. Mr. Rulis?
Aye.
Mr. Rue?
Aye.
And chair votes aye as well, so carries unanimously 3-0. And that's a good point, Mr. Rulis. Where a lot of times both we and the state have issued long-term or requirements without an end date because we weren't sure when things were going to end. This is different. This is to get us past hopefully what's a January surge. So we're hoping that this will be as short a thing as possible. So thank you for mentioning the January end date, Mr. Rulis. So I will now turn it over to our new town nurse, even though you'll have our official meet and greet at our meeting next month, later this month. I'd just like to hear your thoughts on spread of COVID right now and additional things you think that residents should be doing or know about it.
Hello, everyone. I'm Ashley, the new town nurse for the town of Tewksbury and Tingsboro. Thank you for that introduction there. I agree with what everyone has been saying here. And as we all know very well, 2 years into this pandemic, the lack of social distancing, the relaxing on the using of the mask wearing, and then just the winter season alone has obviously driven up numbers across every town. And obviously Tewksbury's been hit according to this graph here. So just reinforcing that to the public, I fully support that. And I think that will be a great reminder to let everyone know to continue to take these measures to keep themselves safe and then obviously keep others safe as well, which is very important.
And one thing I'll ask you, and not to catch you off guard in this, because I know that when I was calling up to the department, there was an auto-recorded greeting talking about testing kits. So maybe if you can just briefly update residents in terms of
Sure.
self-test kits and COVID vaccine and booster availability.
Absolutely. So as far as I know, the town of Tewksbury has not doesn't have testing kits that we're giving out to the public. We did not obtain any, but it's been hard to get, as I'm sure a lot of you guys know, to get those rapid tests and PCRs. But we continue to I guess, recommend always reaching out to your healthcare provider, seeing if they have any recommendations of where they're getting their testing or if they have any availability in office. And then I have noticed that a lot of these drugstores, Walgreens, CVS, have carried at home antigen rapid tests that have been hard to come by, but if you can buy them, they're very useful and just peace of mind. If you have that runny nose that you're saying that you weren't and you're vaccinated and boosted and you're not sure, is this COVID? Is this just a common cold? It's good to test yourself and stop the spread. At least that way you know what's going on. And then as far as vaccines and boosters, they are our number one defense to this virus right now. So I encourage any resident that is willing to get vaccinated and boosted, that is recommended as well.
Okay, thank you.
Mhm.
And Director Sullivan, anything else you'd like to add?
I don't think so at this time.
Okay. So I think we'll plan on having a follow-up meeting the same time, 11 o'clock on next Friday, and see where the numbers go and get a better sense for what businesses might have enacted voluntarily to get back to the techniques they were employing to try to reduce the spread of COVID-19, which, as a matter of fact, everyone had worked well before, and we're hoping if everyone get back to the basics and do what we'd all done before, we collectively can help turn this in the right direction. So with that, Mr. Rue, I think it's time for your motion.
Mr. Chairman, I'd like to make a motion that we close today's meeting.
Okay, so I'd like to second that.
I will second that.
Okay, motion's been put forth and second to adjourn today's meeting. We'll take a roll call vote. Mr. Rue?
Aye.
Mr. Rulis?
Aye.
Chair votes aye as well. It's unanimous. So it is 11:28 a.m. Good morning, Tewksbury. Usually it's good night, Tewksbury, but good morning today. And we'll be meeting again live on next Friday, and hopefully we'll have some better news to report. But we all have a hand in what we're able to do, and I think collectively we can make a difference. So thank you all for attending, and thank you for any resident that was viewing today.
Thank you.
Thank you.